At this stage where we have community transmission with people still doubting whether COVID-19 is real or not, it's important that we have the right communication go out to the people. Are you considering equipping the PHCs, who are the closest to the people, to perhaps take on this role and reach out to the community beyond the border, the premises of the PHCs, to perhaps pass communication that would help in curbing the spread?
That's a very brilliant observation, Ibrahim. So you will recall that a few weeks ago, we sent out a public service announcement around the need for routine services in the primary healthcare centers to continue, right, irrespective of the COVID-19, irrespective of the lockdown. But one thing that we have consistently done is to bring in our traditional leaders, our religious leaders, to be a voice in risk communication, sending very clear messages to community members about the fact that they are at risk, to avoid stigmatization, to avoid discrimination against people who have suspected symptoms that are akin to COVID-19. And we have seen, just like we did with polio eradication programs, where the traditional leaders have been front and center and been engaging with the federal government and their communities. Again, we've had meetings, virtual meetings with the traditional leaders, and we continue to engage religious leaders as well in their different platforms, because community members listen to these people, right? Culturally, they have more faith in these people more than anything else that they are hearing out there. So we're beginning to see a situation where, with community transmission, the traditional leaders are more involved. They're asking questions. They're also transmitting same to their community members. We also have a retinue of community-based volunteers, village health workers. We also have the junior community health extension workers who link the services from the primary healthcare centers to the communities. We've moved all of this array of primary healthcare workers towards going house to house, community to community, to provide correct information. Okay. We're using traditional leaders and their town announcers to make sure that this information is passed on from community to community. But we do know that this is not happening consistently across all states at the same time, because we're building capacity at the same time as we're rolling out all of these interventions. And then, of course, we've also repurposed some of the technology that we've used with the polio eradication program, such as the Avada, which is able to, say, for example, allow community informants identify suspected cases of COVID-19, and then they're able to use their mobile phones to send a message to the command center and say, here is somebody that has this sort of symptoms. I need somebody to come and maybe examine, and then what else should I do? So we're using the technologies, the experiences from the polio eradication program to bear in the COVID-19 outbreak response. So we're really optimistic about what we can do.
We do know that, I mean, the PHCs have suffered lack of facilities to do their basic job in some places. You have done training, which is a good thing. They've got PPEs to assist them tackle this heads on. But has there been improvement in terms of facility at the primary health centers?
You know, Ibrahim, one thing that is very clear from this COVID-19 outbreak is that we have a weak health system. And I think everybody at the Federal Ministry of Health and the agencies have been saying this repeatedly over the last few decades. In the last few decades, there has been a suboptimal investment in health, right? Well, the same can be said of other sectors. But like we know, a healthy nation is a wealthy nation. If you invest in your healthcare system, then you will have a healthy population that will be able to improve the socio-economic standing of the country, and of course the GDP. Right? There's a direct a connection between a healthy population, a population that has kids that are well nourished, that go to school, and their performance in school and how we're able to compete on a global scale when it comes to technology and socioeconomic development. So we're at a situation where the primary healthcare system, like we've said in the last few years, have not had the kind of investment that they're supposed to have. So of course, even with the building of the capacity of primary healthcare workers to surmount COVID-19, we are aware that we still have challenges with the infrastructure of primary healthcare centers. We know that we do not have the complement of primary healthcare workers that we need in these primary healthcare centers. So our advocacy has always been about increasing the numbers of primary healthcare workers, making sure that they are well trained, making sure that the infrastructure is right, and we have varying degrees of compliance from the government. We do hope that with the experience of this outbreak, that it will awaken our awareness on the need for us to have a better health system, right from the foundation, which is the primary healthcare centers, all the way to the tertiary health system. But like everybody is doing, we're trying to do the best that we can, given the difficult situations. And we know that there are economic challenges. You know, we know that the price of oil has not been what we had hoped it will be. But we all also know that we have to prioritize all those things that are important to us. But I think very clearly there's a need for us to invest more money in the primary healthcare centers, in the health sector. But I will dare say that the current administration of President Muhammadu Buhari has made a huge investment in the health sector, in the primary healthcare center. For example, with the provision of the Basic Healthcare Provision Fund, that's a huge and unprecedented opportunity for us to invest in primary healthcare, and we're already in the process of making sure that the resources that are provided by the federal government goes directly to the primary healthcare centers to take care of the basic things like infrastructure, commodities, utilities, hiring human resources, so that with these kinds of resources, the primary healthcare centers will be better prepared to be able to provide quality primary healthcare services. But also when there's an outbreak such as COVID-19, other outbreaks, be they Lassa fever, meningitis, or even Ebola, that the primary healthcare centers and the communities are better prepared to manage such outbreaks.
These are really difficult times, ain't they? Especially for no less the state governments that would seem to be overwhelmed right now. They're putting our isolation centers, they're trying to equip them, they're trying to man borders. A whole lot of things is going on. How much collaboration, how much of their attention are you getting to partner with you in achieving what you intend to achieve at the PHCs?
Oh, the governors have showed a lot of leadership. The collaboration with the National Primary Healthcare Development Agency and the Federal Ministry of Health has been very strong, especially through the platform of the Nigeria's Governors Forum. Dr. Ofayemi has been outstanding in terms of his leadership, making sure that the governors are working together. But of course, as you're well aware, that level of collaboration will differ from state to state. In some states, we see outstanding work, we see outstanding leadership, but in some other states, there is a need to do a whole lot more. But one thing that is unique across all of these partnerships is that there is a deliberate attempt to try and protect the citizens of the state. So the governors are doing exceedingly well. And for those states where we still have challenges, the communication is still going, the negotiations are still going around how we can, as one team, as one country, improve our response to COVID-19.
It's a very daunting task, but I believe it's achievable if we work a lot harder and more focused on what we should be doing. Dr. Faisal, we would like to thank you very much for coming, and of course reach out to all of you on the front line who are battling this pandemic. Thank you for coming on Dateline Abuja.
Thank you, Ibrahim. It's been my pleasure.
Now, thanks for staying tuned. The coronavirus can spread if you touch a contaminated surface and then touch your face. And while in public, please avoid touching door handles, stair rails, etc. as much as possible. Clean all surfaces with soap and water or disinfectants regularly. Let's continue the conversations online through the email address and Twitter handle on your screen. Also, be sure to share anything that is happening within your locality with us. I'd like to remind you that you can view the program on youtube.com/channelsweb/videos. I'm Ibrahim Adra. Stay safe and see you next time.